Hello. In this short video, we will be addressing some key public health issues concerning Guatemala. We are an expert group at the Ministry of Health of Guatemala assigned with the task of creating and implementing an action plan to improve the overall public health of the country. We have created a short presentation to outline the proposed necessary interventions. For them to become a reality, financial and technical support from both governmental and non-governmental organizations will be needed.
Only 51% of the population live in urban areas, and rural conditions are characterized by low health standards and high levels of mortality. Therefore, it is rather important to highlight rural populations as a key focus of public health campaigns. Examining the data based on risk factors, cost effectiveness, and impact on overall health and the economy, we have narrowed down the focus of this video and action plan to 3 public health issues, in which it is absolutely necessary to intervene. The 3 public health issues are as followed: high mortality due to poor neonatal conditions, diarrheal disease, and lastly, mental and behavioral disorders among young adult and adult populations.
Neonatal conditions are concerns of our action plan because they are one of the top causes of mortality and morbidity in Guatemala, especially because they are preventable with skilled healthcare providers and simple healthcare facilities. To address this issue, the proposed action plan centers on highlighting neonatal conditions as a main focus of the integrated management of childhood illness to help prioritize the recruitment of well-trained healthcare professionals to both serve in hospitals and to train local aspiring professionals to allow them to serve in rural communities. Currently, the only option for citizens in remote areas are midwives, who are typically uneducated and untrained. This training and mentorship intervention would allow better access to healthcare services, increasing the chances of safe births. Investment in healthcare facilities, both in terms of expansion and cost-effective equipment, such as portable ultrasound machines to assist in safer gestations and births across larger areas, must follow, since the majority of deaths occur during birth. Providing women in labor and their newborns with adequate medical attention during and immediately after labor are essential as a preliminary step that will result in major improvements in the health sector. The plan aims to decrease the dollars lost to neonatal conditions by a minimum of 25% by 2025, and to see a significant decrease in infant and child mortality by that time as well.
Diarrheal disease is a major cause of death for all age groups in Guatemala. It is caused by infection, which is generally linked to inadequately sanitized water. Water is the most basic necessity of life, yet it is difficult to access or maintain in a clean and consumable form in Guatemala, particularly in rural areas. The ingestion of fecal matter is one of the most dominant causes for fatal diarrheal disease and can be directly linked to the quality and sanitation, or lack thereof, of water. Other risk factors for diarrheal disease include insufficient water supply, water contaminated with communicable disease agents, and poor hygiene practices. More than 40% of Guatemala's rural dwellers do not have access to water in their homes, and even those who do often lack the most basic sanitation. Such infection arising from water can also be spread from person to person due to the lack of hygiene, and people who suffer from malnourishment or have a weakened immune system are at higher risk of contracting diarrheal disease.
In order to continue to make progress and decrease the burden of disease caused by diarrheal diseases in Guatemala, some key immediate interventions must take place, such as those listed on the screen.
The funds and grants received can be used to develop projects to bring sources of water to communities, or to improve transportation of water from reliable sources to them, ensuring access to at least half of those who do not by 2020. Developing water treatment facilities, public latrines, and hand washing stations alongside these projects are absolutely necessary, making certain that a minimum of 75% of rural dwellers have adequate sanitation.
According to the BBC, the Federico Mora Hospital, one of only 3 mental health hospitals in Guatemala, is the world's most dangerous hospital. That being said, mental and behavioral disorders cause the highest DALYs in Guatemala for young adults and adults. While mental and behavioral disorders often are not a direct cause of death, they are an important indirect cause and lead to detrimental effects on one's quality of life. To lower the burden of disease of mental health issues, the changes shown on the screen must take place. Out of all the countries in the Latin region, Guatemala does not have the highest drug abuse rate, but because of its location, it is a prime trafficking country. This has initiated a growth in the amount of people with knowledge and access to drugs, which has in turn caused an increase of the population abusing or becoming addicted. Investing in social services to assist in the recovery of addicts and encouraging setting regulations in place are key to help reduce DALYs caused by both mental health issues and interpersonal violence.
For all 3 of the above public health issues to be alleviated and for the interventions suggested to be effective, it is important for rural communities to gain the ability to serve themselves. Rural communities must begin to develop internally with some external support as a long-term solution. This is precisely where this action plan comes in hopes of establishing a degree of independence in the long run. None of this can be achieved without the dedication and generosity of well-informed and resourceful donors, and so we present this proposition to you in hopes to gain support for this country.